Hello, everyone. My name is Darcie Green, Executive Director at Latinas Contra Cancer. I'll be talking about disparities in accessing mandated fertility insurance benefits. Latinas Contra Cancer, we're an organization. We've been around for 21 years. We serve primarily the low-income community and documented community, Latinas who are in many different gaps that exist in accessing lots of different types of care, and also folks who are underinsured. Most of the folks we're serving are on Medi-Cal. Okay, let me tell you a client story. We are not using our real client name, but at just 22, Olivia had already spent many years of her life battling cancer. When she came to us, as many people do, she had just faced an impossible choice. Her treatment was threatened her ability to have children, and she was given only a brief window to decide whether to pursue fertility preservation, care that had just been already legally recognized as a basic health service in California, but as we've come to realize is often not treated as such. Olivia and her mother and her partner chose preservation, even though for them, because they didn't qualify, it meant taking on significant debt. Then the pandemic hit, and the family that was already just making ends meet lost all their household income and became shadowed with this medical debt, leaving her overwhelmed by medical bills and emotional stress. This wasn't just a difficult decision for Olivia, it was an unjust one. Olivia's story reveals the systemic inequities that force low-income women and people and underinsured patients to carry burdens that no one should have to bear. What we learned from this client story and others that have come after it is that fertility preservation isn't a privilege. It is a matter of health, racial, gender, and reproductive justice. And we believe at Latinas Contra Cancer, we can and must do better. So here's what we know. Persistent disparities in accessing mandated fertility preservation coverage in California exists. There are preventable challenges for low-income women and Medi-Cal patients and communities of color, and we can propose innovative health justice-based solutions. So some of the things that we see often is just this awareness and access gap that we've already been speaking about. I think it's particularly acute for people who are not just because they are low income, but all of these other social factors that kind of weave together, conspire at the worst possible time against them economically and socially. So many patients don't even know that they have rights under SB 600 or they have this policy. Medi-Cal patients often lack clear guidance or information. Just as we all are trying to figure out clear guidance information, it's particularly hard for folks to figure out whether they qualify or not. And then there's this added layer of language barrier and misinformation. Healthcare itself is its own language. So that's one language that our community has a really difficult time understanding. And then there's this added language of not speaking English and a system that is not set up to adequately meet the needs of Spanish speakers. And this exists for communities of color too, regardless of income, frankly. There's this bias that exists. So some of the shortcomings that we've experienced, again, we're serving folks who are falling into this like other gap within the coverage that didn't expand coverage to Medi-Cal patients. So limited scope, right? Excludes self-funded employer plans, exclude many fertility preservation services are not covered. And then this is what we're also seeing as this lack of oversight. I've learned today that there are enforcement mechanisms and there are penalties, but maybe accessing them is something we need to discuss. So I was really happy to learn a lot more about that earlier from Katie. So here are some economic barriers for low-income women that we help people to navigate. High out-of-pocket costs. So in Olivia's case, she took on the medical debt, also the storage. And we talked earlier about like, well, the storage fee is small, but for her at 22, having lots of income, it was huge. It was huge. And very overwhelming and very, very stressful. Medi-Cal patients and uninsured women face financial hurdles already in accessing care. And so this really, I just want to underscore the reproductive justice aspect of it, and that there shouldn't just be some people in the state of California who get to have that choice, and disproportionately women of color are left not having the choice to make families. And these barriers disproportionately impact people of color, as we just mentioned. So the equity and systemic accountability, SB 600's promise is undermined by the lack of systemic accountability. We're really excited and applaud the legislation, but a lot of the like where the rubber meets the road and the devil being in the details is really undermining what's possible with the legislation. True health justice requires addressing these structural inequities, and centering low-income women and communities of colors is essential. I want to underscore that last part. I think leading with the voice and stories, and more than just lived experiences, but really leading with the leadership of low-income women and communities of color is, I think, going to be key to realizing the promise of this legislation. Okay, so as I come to the conclusion, here are some policy recommendations that we've thought of at Latinos Contra Cancer. These are certainly not only ours. These are, I think, widely accepted ideas. Expand XP 600 to include Medi-Cal, right? And we think that's really important. It's number one on purpose. I used all my 3 stars on it in the other room. It's, I think it's really important because we see this every day, and well, not every day, but we see this, and it's heartbreaking and angering. Institutionalized legislative language that affirms preservation as a basic healthcare service. We know that that is written there, but it is not actualized, realized, institutionalized for everyday people and everyday Californians. Develop accountability metrics for SB 600 compliance. I've learned about how hairy that is, how kind of complex that can be, but I think I feel hopeful that we can find a way to create some of these metrics to develop better accountability so that the intent of the legislation is actually happening. Some advocacy recommendations. We are a health justice organization at our core. We believe in the power of patients. We believe in the power of Latinas. So partnering with grassroots organizations for awareness campaigns in the community, creating community-based navigation hubs with multilingual advocates, investing in patient-led justice movements. Sometimes maybe these things, and we heard earlier this morning from the senator about the power of stories, the power of everyday people to move legislation, creating the consequence, creating that may require some allyship more than just the number of people who might need the service, because that might not be that many in the state, but really developing the power of patients to demand justice, even if this might not be a service they themselves are going to need. And then pilot maybe a subsidy program, one that takes this firmly out of the space of charity, like something that you need because, something that you need because you somehow don't have enough money, or you somehow have done something wrong that you can't afford this, but looking at ways that our safety net system can provide people with the resources that they need to access this care because they deserve it, because it's their like basic human right to be able to do this, and not relying on it being a matter of charity. So thank you. Those are our suggestions. Wishing you all more justice and more peace.